Welcome back, everyone. I hope you all had a nice break. Thank you for being with us for the day-long presentations that are before us with the agenda. It has been an absolutely fabulous morning. So many lessons learned, information shared that I think all of us can take back into the community to making it a lead-safe place for all. So just to wrap up a little bit from our morning discussion, I wanted to share just a couple of insights and thoughts related to what we heard. As you know, and as I mentioned earlier, in case you joined us a little bit late today, I'm Michelle Nakarati-Chapkis with Women for a Healthy Environment and also chair of Lead Safe Allegheny and the coalition that works hard all across the region to making certain that we have lead safe spaces for our residents. There were a lot of common themes that emerged from this morning that, were resounding issues that just kept coming to the forefront that I think are important to highlight. One of them is related to policies. We had that question come up several times in terms of who is at the table and are we having the community voices represented? And that is really a crucial element to in a theme of today that we want to make certain that folks continue to ask that question. So we have to be inclusive of those living in frontline communities first and foremost. So that's one of the things that I hope you all heard this morning that you can take back into the work that you do and into the communities that you live. One of the other things that we heard is that certainly community has to be involved in the process from the very beginning. We can't go to a policy and say, as we heard this morning, what do you think? Any feedback? But the community members have to be active members of not only the design of the process and of the policy or preventative strategies that are being discussed in a community, but certainly not only the design but also the implementation. And so it takes this collective work and for many folks coming together to making certain that those who are most impacted are heard. So with all of that, I think that there's lots of opportunities for people to take some of these lessons and incorporate them back into the communities in which they work and they reside. But we'll hear a little bit this afternoon about what are some of the very specific strategies that we can hear from a local perspective at the city level as well as county, and then learning about the funding opportunities that'll be available throughout. And then certainly in this evening, we'll have some more targeted discussions about physicians' role and what they can do to addressing these issues. And then also a very targeted communication for those who are renters, perhaps, in looking for strategies and resources for them as well. But for now, let's get us off to our next part of the program today. I have the pleasure of introducing Dr. Noble Massaro, who is Professor of Public Health Practice, the Director of Social Justice, Racial Equity, and Faculty Engagement at the University of Pittsburgh, the Associate Dean for Diversity and Inclusion, and also a member of the Black Equity Coalition. Dr. Massaro has a career that spans more than 40 years in the areas of human services, academia, and public health. He was the founding director of Morehouse School of Medicine's Master of Public Health program, health officer for the city of Detroit, and served for more than a decade as the City of Cincinnati's health commissioner before coming to the University of Pitt in August of 2017. Dr. Massaro is going to be leading our next presentation today, which will focus on data at the local level. Dr. Massaro.
Michelle, thanks for the intro. Maji Niu Hai, water is life. This declaration was visible nationally in Tanzania throughout the landscape when I was there in the 70s. Water is life, but as noted today, it can be poisonous. It can, if it becomes toxic, because it's contaminated with lead. There is no safe level of lead. So good afternoon, everyone. As Michelle has noted, I'm Noble Massaro, and welcome to the data segment of our summit Life Without Lead, Envisioning a Lead-Safe Community for All. First off, before we begin formally, I must make an appeal to everyone to vote November 2nd. Advocacy is a through line in this summit, and public sector accountability is one of the highest forms of advocacy. So vote November 2nd for who you believe will reflect your perspective on protecting and improving the health of the public. So with that said, and no further ado or delay in King Gareza English, it is my pleasure to kick off our afternoon with a snapshot of Allegheny County's local data on childhood lead poisoning and environmental interventions for prevention. This presentation was developed in partnership with the Data Committee of the Lead Safe Allegheny Coalition that supports policy and outreach initiatives by identifying communities disproportionately impacted by lead poisoning. Secondly, improving data surveillance and reporting, depicting lead hazards through mapping and other technologies, and lastly, through improving science communication with the community and health inequities through the public health and healthcare systems. Now, this data that will be shared today will reflect the disparities in health inequities in health outcomes and access to resources reflected upon this morning and will inform our discussions about equitable policy and funding later this afternoon. As you will see, lead poisoning happens in every corner of Allegheny County, but some corners are impacted disproportionately more than others. Effective interventions such as abatement of lead hazards in homes or replacement of leaded drinking water lines must be data-driven. And for this reason, it is my pleasure to introduce you to 4 speakers who represent different parts of the lead poisoning prevention system to help provide a comprehensive picture of how lead poisoning impacts the Pittsburgh region, how we have progressed as a region, and what progress we have yet to make in solving this problem. Okay, so now I was expecting a slide or two, but we'll proceed. Because we have only 45 minutes to do so, we will invite each of the speakers to share consecutively, and we'll open the floor for as many questions for which we have time. As you listen, I invite you to add any question you may have in the chat. If we cannot answer your question before time is up, we will make sure to answer your question in the chat as well as through email if needed. So with that said, I would like to welcome our first speaker, Dr. Luanne Brink, Chief Epidemiologist and Deputy Director at the Allegheny County Health Department. And for the past 7 years, Luanne has been a Chief Epidemiologist at the Allegheny County Health Department. And while she is currently leading the pandemic response, including school policies, case investigation, data analysis, and dissemination, she occasionally gets to do other things, including the analysis and reporting of vital statistics, trends in births and deaths. She also manages overdose surveillance, as well as other infectious disease investigation and control, including hepatitis C-free Allegheny, or Hep C-free Allegheny, as it's known colloquially. Trained as an As an environmental epidemiologist, Luanne frequently works with the ACHD, the Allegheny County Health Department environmental programs, to assess the impacts of environmental pollutants. She is active in the assessment and dissemination of information related to environmental justice, working with both air quality and housing programs. Now, prior to joining the Allegheny County Health Department, she was part of a team that was an academic partner to the CDC Environmental Public Health Tracking Network, researching national patterns in health effects of air pollution and childhood blood lead levels. She remains adjunct faculty at the University of Pittsburgh's Graduate School of Public Health. Luanne will start this segment with an overview of the county data for elevated blood lead levels and screening rates among young children. It is my pleasure to present Dr. Luanne Brink. Luanne.
Thanks, Dr. Massaro. Thank you for the introduction and for really talking about data as that pivotal point between communications and policy that I really hope to serve for this meeting. Will someone be showing my slides then? Thank you. Okay, next slide, please. So as I'm sure you guys have heard already, perhaps multiple times today, there are many things in our environment that can contribute to the burden of childhood blood lead. That includes paint chips and dust that comes from those, especially from windows and things like that, where the surface rubbing can create dust. And that also contributes to lead in soil, as did all of those years that we had lead in gasoline. It was distributed into the soil. We know very well that there remain some leaded pipes. Also, frequently, and I know Brian with our housing division will be speaking about this, but they will often find most frequently imported from other countries without the stricter regulations, toys or jewelry that still contain lead. Next slide. So we know that the health effects associated with blood lead are well documented. They include behavioral problems and learning disabilities. The evidence has, created an environment where we realize that there is really no safe level of lead exposure. The major exposure usually is from that lead-based paint that ends up, either, children can pick it off of, the walls. It ends up in the dust or in the soil, and during their hand-to-mouth behavior as they are, exploring their world. Less often, the lead exposure can occur through air, home remedies, drinking water, and those toys that we just spoke about. Next slide. So how do we get these data? So in Pennsylvania, all of the jurisdictions, the 10 county and municipal health departments, as well as the Pennsylvania Department of Health, receive laboratory data. So all of those lead tests, when the child ends up at Quest Laboratory and they get their blood drawn, that ends up as an electronic lab report that is uploaded to the National Electronic Disease Surveillance System, PA-NEDS. There are 2 conditions that are reported to PA-NEDS where we get both positive and negative reports. One is for childhood blood lead and the other is for COVID. So for those 2 conditions, we can create a % positive report out. And that's some of the trends that I'll be talking with you today. I will mention that these are laboratory reports. So really the only thing, when you go to the laboratory, you tell them your name and date of birth. So we really are, and address. We are limited to really those variables. But we'll talk about how we join that with some other information. Next slide, please. So here in Allegheny County, in January of 2018, Allegheny County passed a universal childhood blood lead testing mandate. which requires that children have 2 blood lead tests before the age of 2. It has attempted to assure that children, families, and doctors will know if they are at risk for the complications related to elevated blood lead levels, and subsequently receive the information to reduce those levels. Next slide, please. So after passing the universal testing rule, we increased our childhood blood testing by over 6,000, almost 7,000 additional children were tested in 2018 when compared to 2017. Now we know that since then it has been fairly disrupted by the pandemic. But since then, and obviously we're still evaluating this information, especially as children have spent more time at home over the past couple of years with the school years disrupted. We're paying very close attention to this. We have noted decreases in the percentage with an elevated blood lead level since 2016. In 2019, there were 434 children who had a blood lead level greater than or equal to 5 micrograms per deciliter, and that was just under 2% of everyone tested. In 2020, we dropped in the number total tested from about 23,000 to just over 20,000 children tested. We did find 341 children with an elevated blood lead level, and that was slightly down from 2019, and it was 1.67%, just over 1.5%. Next slide. So we can see, again, the number tested increased, and that's the first column with the black lettering. Children tested from 14,000 in 2016. We hit a peak of 23,942 in 2019. And as you can imagine, due to people literally being told to stay home last year, we did test fewer children. I wasn't sure if that was Zorro or what, but with a low level of 1.67% elevated. And overall, we're looking at 95 children who had a blood lead over 10. We took a look at some of these kids, and there were a few even with over 20, but that was about the highest levels. Next slide, please. So if you'll note the yellow lines here, these are the number of kids tested every month. You can see in January of 2016, the green line, we had a very high number of kids tested, as we did in August of 2018. We were recording children at their admission to school who had been tested that year. So there was a bit of a surge there. Also, you can see the yellow bars in March and April of 2020. We had the lowest number tested, but we did recover. And if you note the yellow bars on the far right, in July, August, and September, there were a fair number of children tested then. Next slide, please. So these are the rates, the percentages, the rates of elevated blood lead by year. The blue line indicates the city of Pittsburgh. The orange line indicates Allegheny County as a whole, and the gray line indicates Allegheny County excluding the city of Pittsburgh, with the lowest rate of elevated children. And we can see that the city of Pittsburgh has the highest, and we'll go over some of the reasons that might be, most notably the age of the homes within the city of Pittsburgh. But we can see where we're going from about 5% in the city of Pittsburgh in 2016 down to just around 3% in 2020. So there have been improvements made. Obviously, it's not, we're not, at 100% yet. Next slide, please. Whoop. Okay. And so we have analyzed preliminary data this year and noted a slight increase in in the percent elevated. And it's something that, we're having internal discussions about, talking about the children for whom we're able to get into the house and do those evaluations. And Brian will go a little bit more into that. But we can see that even the 10 plus has increased slightly, although we are really looking at just a few events. That's 0.5% overall. We are slightly up from about 1.5%, 1.6% to just over 2% elevated with 5 and above. That's in the gray line. Next slide, please. And we don't keep these data secret. We haven't released 2021 data yet, but all of our other data is available at the census tract level at actually in our website, and you can see that can be found easily at ACHD/lead. And you can go to lead in Allegheny, which is the little houses there on those little icons at the top right. And also we document very well the any changes that we have made in our data reporting, and a snapshot of that is on the bottom right. But we have every census tract aggregated from 2016 to 2020. And it produces the percent elevated, which is the number of children with a blood lead level greater than or equal to 5 micrograms per deciliter over the total number of children tested within that census tract. When there are fewer than 50 tested, we do list it as an unstable percent, but we do provide that information. Next slide, please. So what are our results? Where are the higher risk children? As we know, as with any of the other conditions during Noble's introduction that we really do track, whether that's hepatitis C, overdoses in general, we often see clustering. And, the reasons for that are far too deep to discuss at this point. But needless to say, these disparities do occur. So most of the children with elevated blood lead levels, and you can see that ranges from 5 to 16% of all tests within the darkest blue census tracts, have a blood lead level of 5 or greater. And those are clustered in the city center, and we can follow it down the river, down the Monongahela River, into that river valley in the southern part of our county. Next slide, please. And you can download these data and check them for yourself. I have a couple preliminary analyses at the end of my talk here. So we have it by census tract. These are municipalities and neighborhoods. As you may know, that represents 229 entities within Allegheny County, 130 municipalities, as well as 90 neighborhoods within the city of Pittsburgh. And we can see the same general trend here. I just wanted to point it out that we do have it at this level. In the next slide, we'll show you, I believe, our school districts, which again, we will see that this also is the city center and the Mon Valley. With also top right, you'll see Highland School, and there's a small area that we, has environmental justice issues, has older housing, some legacy industry as well. Next slide, please. So these are the homes built before 1950, which has remained the biggest risk factor, because before 1950, lead was not removed from paint legislatively until 1978. So sometimes we will look at houses built before 1980. However, the higher concentrations of lead did occur before 1950. And we can see that those homes built before 1950 in the darkest red, again, follow those same patterns that we've seen with the childhood blood levels too. Next slide, please. We have other opportunities to download these data. This is on the actually, I believe that this is the Western Pennsylvania Regional Data Center, and that's WPRDC.org. And actually, you can see it in the URL there at the top. We have a lot of health department information available there, as well as the childhood blood lead levels at the census tract level. Next slide. The Pennsylvania Department of Health has joined the childhood blood lead level data with the birth certificate data. As I mentioned early on, one limitation of our analyses is that it is laboratory results. They did join those laboratory results with birth certificates, which do name race of the child, as the lab reports do not. We can see not only is there a geographic disparity, but we can see that there is a racial disparity as well, with non-Hispanic, Black, or African American children having 1.67% of them have an elevated blood lead level, compared to a non-Hispanic white child who has 0.54% having an elevated blood lead level. This is available at the State Department of Health. We are in the process of joining our own data with the birth certificate data. Unfortunately, that was not ready for this talk. I think now we'll go to the last slide. Two slides. One is to introduce our Environmental Justice Index, which includes race and poverty, as does the State Environmental Justice Index. We also take a look at educational status, traffic, availability of parks and green space, particulate matter, diesel particulate matter, and the density of vacant properties in each census tract. And we can see, again, the same patterns here, where the elevated blood lead levels are. And then I think the last slide that we're going to take a look at, we did find, of the 371 census tracts in Allegheny County, I ran a correlation to correlate elevated blood lead level, the percentage of children with elevated levels, with an environmental justice index, and found a significant correlation. We did find just two environmental justice areas that had low elevated blood lead levels, and areas with no environmental justice need all had low elevated blood lead levels. And we can see the low EJ score, meaning that they are well resourced, had a concordance with the lowest blood lead levels in 43 of these cases. And similarly, on the right, with high EJ need, the highest need census tracts, 34 also had the highest blood lead level scores. So just to fit in with the theme of the discussion, the policies, it echoes in Allegheny County as it does everywhere else in the nation. And back to what Noble said at the beginning, we're trying to use these data to communicate effectively with the public and to produce policies that are going to improve the outcomes for these kids. So thank you very much.
Thank you, Dr. Brink, for an informative presentation, and also for you and your team's work analyzing over 20,000 blood tests each year to ensure we have an accurate understanding of lead poisoning across the county. The coalition appreciates your collaboration in many of its initiatives, and certainly what was brought out in the data presentation, and I'm sure we'll discuss this and it'll be brought out in the Q&A, is that the connectivity and the association around housing and also education and the impact that lead poisoning has in those respective domains. I would now like to invite Brian Kelly, Environmental Health Administrator in the Housing and Community Environment Program at the Allegheny County Health Department. Brian has worked for the Health Department for almost 2 decades, all in housing and community environmental, in the housing and environment program. So he is definitely not only a grunt, but now he's an administrator. So he's going to make things happen. So he began as an inspector, and I say that, you know, a grunt, when we say grunt, those are the individuals on the front line. And so he started off as an inspector and is currently the administrator of the health department's lead risk assessment program. So for those of you who have some experience in the military and you're a grunt, you definitely don't want to deal with those individuals who are second lieutenants, but you want to deal with individuals who have some experience of being on the ground. And Brian has that experience. He is a PA certified or Pennsylvania certified lead risk assessor. And Brian will share more about what hazards tend to contribute to the lead poisoning cases discussed by Luanne. Brian, the stage is yours.
All right, thank you very much. Let me just apologize for my voice too. I have a cold. It's not COVID, but it's the first cold I've had in a year and a half. So I'll try to power through my presentation here, hoping my voice holds out. So let me just briefly talk about what we do out of my program at Housing and Community Environment. We do lead risk assessments for children in the county that have a confirmed venous blood lead level of 5 micrograms per deciliter or above. And we get that data from PA NEDs. I have access, so I see those test results as they come in, which lets us, really reach out to the families quickly and start our process with them. The first step in that process, though, is to contact them over the phone. That's done by one of my co-workers, Juanita Brown. I believe she was on a panel earlier today. And when she talks to the family, she's going to go through some education and a questionnaire we use to try to help determine, what parts of the home the family thinks might be a concern, if there's any hobbies or occupations that might bring lead into the home. And through her education, she really tries to, talk to the family about ways they can help bring that lead level down through some simple, lifestyle changes, taking care of some issues in areas where a child spends most of their time in the home, things that they can do for themselves right now. When we get out to the property, the risk assessment will attempt to identify all the possible sources for that child's exposures. So we do that in a number of ways. Our main tool is Xrf Analysis. Xrf is a machine we use to test any painted surface in the home. And the machine will be able to tell us if there's lead paint present in any layer of paint on that surface. The machine has a small nuclear source in it. When we put it against the wall and pull the trigger, a shutter opens, releases some energy into the paint. Some of that's bounced back to the machine, and the detector will be able to analyze that and tell if there's lead there in that painted surface. That's done every room in the house, top to bottom, inside and out. Every painted surface is tested. We also take a water sample looking for lead in the drinking water, and we also take dust samples throughout the home in areas that the child has access to. If there's any bare soil on the outside of the property, we will also sample those areas. If consumer goods might be a concern for the family, we do have an Xrf that can test consumer goods. It has a consumer goods mode, so we can look at those for the family. Next slide, please. So I just want to talk very briefly about declined services and no response from families, because our services are completely voluntary for families. They don't have to accept health department services. Families do decline, as you see here. What we do, though, is that when we give them a call, we'll leave a voicemail if we can, and we'll give the family 3 phone calls with a voicemail trying to reach them. If we don't get a response, we send a letter to the address we have on record from the PA NEDS test result, trying to get a hold of them. If they talk to us and they decline, or we never get a hold of them, we send a letter following up to the pediatrician, which is listed on the PA NEDS test result. we'll just send a letter to the pediatrician stating that they've declined. We're certainly happy to offer services again if they want us to come on out there in the future. Certainly, the pandemic has caused an uptick in declines. It's been difficult for us and definitely for the families we serve. And last year, there was about 2 months where we didn't do inspections for about March to early May. But since then, we have been going into homes, doing full inspections, and throughout all of 2021, we've had services as normal. Certainly, though, families inviting us into their home, we've had a slight uptick in the number of folks declining, but we do try to talk to every family, so that's why our no responses have gone down. Next slide, please. As part of our phone education that Juanita does, she does ask if we can make a referral for early intervention services for that family. Any child in Pennsylvania, any child that has a blood lead level of 5 or greater would qualify for early intervention services. Here in Allegheny County, children 0 to 5 would qualify. For kids 0 to 2 years of age, that's done by the Alliance for Infants and Toddlers. As you can see here from our data, we've had quite a number of referrals over the last 3 years to the Alliance, less so for children in the 3 to 5 year range, which makes sense because most with the county regulation on blood lead testing, kids should be getting that first test at the 9 or 12-month well visit, and then again at the 2-year well visit. So that's where we're capturing most children in Allegheny County. During the course of our talk with them, if they indicate that they're already receiving services, we do record that, and you can see that there. But we do have a good number of families who decline to have that referral done for a variety of reasons. These referrals are also done through doctors' offices. So we don't get into why they refuse a referral during our education, but it certainly is something that we see. Next slide, please. All right. So on this slide is just an overview of how many inspections that we've done over the last few years. So prior to June 2016, our lead risk assessment program was funded by a grant from the PA Department of Health. It was a CLIP grant, childhood lead poisoning prevention program. And this program, since it was grant funded, it also allowed our health department inspectors to go to surrounding counties. So we would go to do inspections in Washington County, Fayette County. For children, as you can see here, from 2010 to November of 2016, a blood level of 15 or greater was required to get an inspection done by the health department. November of 2016, we lowered that level to 10, and then finally in June of 2018, we lowered that level to 5. So at 5 on a venous blood draw would qualify a family for a lead risk assessment. And you can see, starting in 2018, we really had a jump in the number of inspections that we've done, 105 in 2018 to 135 in 2019. And with the pandemic, that number has dipped. 86 homes were assessed last year, which I'm very proud of considering everything that's gone on. And this year in 2021, we are on track, I believe, to get above that number again, probably in the vicinity of 90 to 95 inspections, I think, by the end of the year. Next slide, please. Okay. This may be tough to read for folks, but I just want to talk briefly about what we've found the last few years on our inspections. Really, the main driver that we find for the kids we do inspection for, it comes back to the paint and the dust that comes from the paint. So in 2018, in the 105 homes that we have inspected, we found defective lead-based paint in 86 of those homes. Out of those 105, we also found lead dust and elevated lead in the soil in 59 of those homes. The soil, the lead levels in the soil, it's not just emissions, gas, leaded gasoline, industrial emissions, but most often we find that exterior paint, as it weathers, it'll wash down into the soil surrounding the home, and we'll get high levels of lead in that soil. So again, it comes back to that paint. In 2019, with 135 homes inspected, we found defective paint in 117 of those homes, elevated lead dust in 88, elevated soil in 95. In water, 2018, we found 0 homes above the EPA action level of 15 parts per billion. In 2019, we found 3. We do find homes where we find no environmental source, that being lead, paint, dust, soil, water. 19 in 2018, 18 in 2019. In those instances, we start to look at consumer goods, spices, cosmetics, toys, cookware, things a family has brought from overseas if they're a recent immigrant, things that are sent to them by family members. So we do find those. Next slide, please. All right. Again, in 2020, 72 homes out of 86 had defective lead paint. In 2021 so far, as of 9/29, we've inspected 68 properties. 61 of those had defective lead paint. So again, you can see lead paint is really the main driver of the elevated blood lead levels that we're seeing for families that we do inspections for. So, going back to the alternative sources, some of the things that we have found in the recent past are things like turmeric, bangles, costume jewelry. We found some cookware, brass pots, pans that families are cooking meals in repeatedly, serving it to the family. When we find things like that, we give that information to the family and give them our advice, which typically is to discard these materials to get this exposure out of the family's life. And often the families are very willing to do that. Next slide, please. All right. So this is just a brief overview of where we've been doing our inspections in Allegheny County. All 130 municipalities are eligible for us to come on out and do an inspection if they have a child there that has an elevated blood lead level. From 2017 to 2020, we have done inspections in 71 of the 130 municipalities in Allegheny County. Certainly, it sticks out here. Pittsburgh, over those 3 years, we did 166 inspections in the city, which accounted for 43% of our inspections done. That last column breaks it down by city ward in those 3 years. Some of the areas that we go back to repeatedly, the 11th ward, 13th and 14th ward, which is in the east end of the city, 19th and 20th ward, which is in the South Hills. And then on the north side, 26th and 27th ward are areas that we do the majority of our inspections in the city. Next slide. So this slide breaks down the inspections we've done in 2021 so far in Allegheny County. Again, the city is well represented here. We've done 50% of our inspections have been in the city of Pittsburgh so far this year. Trends continue as they have been over the last few years. Beginning in 2021, Juanita, during the questionnaire we go over with the family, started to ask the families about race and ethnicity. You can see our breakdown here. So far in 2021, 26, and this is the families, this is how they are identifying their child to us, race and ethnicity. 26 Black or African American, 22 white, 5 Asian families, and 16 of our families identified their child as being more than one race. Ethnicity, 63 not Hispanic or Latino, and 4 were Hispanic or Latino. So we will continue to collect this data moving forward, so we can get a better understanding of the populations that we serve. Next slide, please. All right. Just very briefly about what happens after we're done with one of our inspections. The samples we take are sent to a lab to be analyzed. Once they come back to us, the inspector will write a report highlighting location of lead hazards in the home, results of the environmental sampling, and guidance on how to correct those issues. In rental properties, it's sent to the owner and property manager as well, and we do an enforcement. The owners are obligated to make repairs in the home. If they don't, we can follow up with a fine to them. When we go out to re-inspect, we're going to check that those lead hazards are corrected, and if they are, we do another round of dust sampling to make sure that everything's been cleaned up properly. Next slide, please. All right, and finally, I just wanted to end here with our contact information about housing and community environment. Feel free, if you have any questions, give me a call. I'm happy to talk to any family who has concerns about their home and just wants a little bit of education. All right, thank you very much.
Okay, Brian, thanks a lot. Much appreciated. And just want to offer some context here as Brian and Luanne was referencing the 5 micrograms per deciliter. That's the reference point for the Centers for Disease Control. However, for those of you, you should know that the Healthy People 2030 has the target for the lead level, blood lead levels is 1.18 for 2030. And so the baseline that they're using is 3.31 micrograms per deciliter. So when we see that 5 micrograms per deciliter, that's the reference point. And primarily that's the reference point since roughly, I think, 2007 or 2008. It used to be 10 to 20. So anyway, I just wanted to provide that information so that we'll have a sense of the 5 micrograms per deciliter, and for us to push on so that we can hit that target of 1.18, but we're not going to wait till 2030 for that 1.18. So Dan Duffy is like to invite Dan to the to the stage, to the conversation. Dan is someone who we have talked and had plenty of discussions in our conversations. He's with the Pittsburgh Water and Sewer Authority. He's a consultant with PWSA, and Dan manages the lead service line replacement programs and has been doing so since early 2018. And he has over 33 years of experience in the engineering field and has all types of credentials. That includes the Master of Science degree in Civil Engineering. And he is a registered professional engineer in 4 states. So without taking any further time, Dan, I know you want to talk about the success and the good work that's taking place at PWSA in the lead service line replacement. The floor is yours, sir.
All right, thank you for that introduction. I've got some slides that will hopefully pop up here. Again, my name is Dan Duffy. I'm just going to talk briefly this afternoon about some of the work PWSA has been doing with regards to lead in drinking water. You can go to the next slide, please. So our lead service line replacement program really kicked off in 2018. We had a lead action level exceedance in our drinking water in 2016, but the initial efforts, since we were restricted by law from replacing private lead service lines, the initial efforts were kicked off in 2017, but we quickly put them on hold when we saw some elevated lead results as a result of doing partial service line replacements, which was all we could do at that point in time. So in 2018, we kicked off a major effort replacing service lines. We were extremely fortunate to get over $49 million from Penvest to continue that work in 2019 and early 2020. And we are presently replacing lead service lines as part of our water main replacement program. So that work has been ongoing since late 2020 and continues. So to date, we've replaced almost 8,800 public lead service lines and almost 5,800 private lead service lines. Next slide, please. These next few slides, and it's a little difficult to see in the beginning, but they just show the distribution of our work over time. There's not a lot you can make out on this. This is the service lines we replaced from 2014 to 2017. Next slide, please. In 2018, you can see some of the green dots that indicate our neighborhood program. Next slide, please. 2019, next slide, please. 2020, and next slide, please. And where we are today. So you can get an idea and an understanding of the distribution of the efforts we've undertaken to date based on these plans. Next slide, please. So I want to talk briefly about how we determine where our work happens. We developed a formal prioritization model in 2019 in conjunction with our Community-Led Response Advisory Committee. And that model looks at our entire water service area and evaluates 4 primary criteria. We do it on a census tract basis because that's where much of the data that we use is based on. And we start with that great data that Luanne talked about in the first presentation this afternoon, the blood lead level data that ACHD compiles. We also look at the number of children under 6 years of age and women of childbearing age, as they're the most sensitive population to elevated lead levels. We look at the neighborhood income level and the number of lead and unknown service lines. We weigh the first 2 factors more heavily because they're more health risk based. So we weigh each of those at 40%, and the last 2 factors at 10% each. And then we update that model whenever we start pulling together a new program. So we did an update this summer using the 2020 blood lead level data from ACHD. We're still waiting, or at that time, the 2020 census data was not available, broken down into the categories that we use. So we're still using the 2010 census data, but as soon as the new data becomes available, we'll update our model. Next slide, please. So some of the programs we have planned for next year. Again, we're replacing water mains on an annual basis. We use that prioritization model I just discussed to help us determine where we do those water mains. There's also other factors we need to evaluate, including, how many times a water main has broken and what the water flows are if we need to increase water flows and pipe diameter. But we use the prioritization model as one of the primary determinations as to where we do that work. And we're generally between now and 2026, which is our planning horizon in our capital improvement plan, we've got planned between 6 and 20 miles of water main replacement per year. For 2022, the city of Pittsburgh, I'm sure many of you are aware, awarded us $17 million from their American Recovery Plan funds to put towards lead service line replacements. So we're very happy about those funds, and we've got a program that is in the final stages of design that we hope to kick off next spring, probably early March, as soon as the weather allows our contractor to get out and start work. We also were awarded last week $4.7 million from Penvest, and those funds will be focused on what we're calling priority sites, which are child care facilities and locations where we've had a water sample exceedance. We also have another program where if our operations department needs to replace a public service line that's leaking or is broken, we will go in and do the private side at the same time to prevent a partial. And I don't have it on the slide, but our last program, which is also ongoing, is an income-based reimbursement program. So if somebody is not in a neighborhood where we're doing one of our planned projects, they do have the ability to replace their own private side service line. And based on their income, we will reimburse those costs anywhere from 100% to a minimum of $1,000 stipend. Next slide, please. In addition to replacing our service lines, which is also a priority, we continue to maintain our corrosion control treatment. This was something that was originally revised in the beginning of 2019 with the use of orthophosphate. Our last half of 2020 and first half of 2019 and first half of 2020, our sampling results showed the effect of that orthophosphate addition. We got very good results with respect to the action level, which is 15 parts per billion, and the levels that we had seen prior to use of orthophosphate. We are currently doing another sampling event right now that started. The sampling time period is July through December of 2021, so those results will be available in 2022. And then we also continue to look at that treatment to make sure that we're optimizing that throughout the system with some bench scale type pipe loop studies, monitoring that we do throughout the distribution system. If we see an exceedance at a particular residence, we will go out and do some further investigation to try to understand what that exceedance is from. Next slide, please. So we still have work to do. Based on our latest estimates, we think there's around 7,900 public and around 10,900 private lead service lines that remain in our system. Corrosion control treatment isn't a one and done type process. It's something that requires a lot of diligent evaluation and monitoring that we continue to do. And as I said before, we're continuing to replace water mains and service lines until we get them all upgraded. With that is my end of my presentation.
Dan, thanks so much for what you're doing and your PWSA colleagues for your work to protect the residents from lead in the water and your transparency, because as I said, you and I, we kind of connect periodically on the lead service replacement line initiative. And so when you think about lead service replacement lines, also think about jobs and economic development. And so we're working on that with PWSA. And so for those who are interested in workforce development and those kinds of issues at PWSA, contact Logan Carmichael. Logan Carmichael. If you can't find Logan, you can find me. So without further delay, let me bring on Gene Sachs. Gene Sachs, native Pittsburgher. Gene is the program manager of the Allegheny Lead Safe Homes program at the Allegheny County Economic Development. I said lead service replacement lines and jobs, economic development. So this is a good thing. So Jen has been in this position since 2017, so she's no neophyte. Prior to her career in the lead remediation field, Jen has worked with homeowners affected by Hurricane Sandy to rebuild their homes. All right, Hopkins grad, the stage is yours, Jen.
Thanks, Noble. I want to talk today about the sort of from a housing perspective, where the lead is in Allegheny County now, and then what this program that we do have has been able to somewhat help with that. So, of course, you can put up my slides. All right, thanks so much. That's me. On to the next. Okay, great. Yeah, so as a lot of people have touched on, in this county, we have like a really broad need for lead remediation. There's over 500,000 occupied housing units in the county, and 78-ish% of those were built before 1978 when lead paint was banned. There's also about 50,000 occupied housing units with children under 6 living in them. So if you do the math, that's about 40,000 homes that are built before 1978 that probably have a child under 6 in them now. So that's a lot of work we need to do to remediate lead paint in the county. You can do the next slide. Also, obviously, there's this big problem and we need some contractors to do that work. So in terms of kind of scale, the amount of home improvement contractors that are registered by the state of Pennsylvania in Allegheny County is 4,798. So that's a lot. That's a pretty large workforce. And that is the registered firms, not the workers themselves. But then, of course, the firms that have the EPA renovation and paint license, there's only 300 of those. So, the knowledge about lead paint and the certification to remediate the paint that is needed is really just not there. Also, for an even more intense certification license that we require for our program and for any to participate with any federal funds is the state's lead abatement license. And in Allegheny County, there are 23 of those, and some of those don't even really do residential work. So as you can see, the certification, the enforcement, the knowledge is really something that's lacking on the whole. Next. Okay, so in our own small way, we are trying to help out with this. So we have a contractor training program that's part of the Allegheny Lead Safe Homes program. So we concentrate on training contractors to work on our program to remediate lead safe homes that are eligible through our program. And we've had these efforts since March 2017. We've trained through this hundreds of people and did a couple dozen firms over this time period. And over that time, we've learned some things about some of the best practices to impose. One is just to make sure that the message gets out there to contractors directly and to the community in general, working directly with the training providers that actually hold these courses to make sure that they're connecting with contractors, they're getting the word out, and then also to coordinate the scheduling so that there will be people in those classes, and then obviously for money helps to pay the trainers so they can hold these courses and the contractors can receive the benefit of this education. Also, I mean, the biggest piece for us right now to incentivize these classes to happen, for the contractors to get these certifications, is the fact that we have this funding to then pay them and give them work that they need the certifications for. And then the other piece that we've just sort of learned over time is working really, really closely with the contractors from kind of soup to nuts of, getting in the classes, helping them fill out the paperwork to get their certifications, making sure they are able to follow all the steps that the state or the EPA requires to actually then get the certifications after they've learned what they need to know. Next slide. Yeah, so I've sort of alluded to our program, and we call it the Allegheny Lead Safe Homes Program. It's a grant we've received, the Allegheny County Economic Development has received from HUD, the Office of Healthy Homes and Lead Hazard Control. It's $5.6 million. We received this in 2020 and just got started this year. This is our second round of this funding. There's also, as part of this, $800,000, which is a local match contribution of $800,000. So this is geared towards low-income families that live in Allegheny County. There's no restriction on where they're located. It's solely income-based. And it's for homeowners and renters. For homeowners, there needs to be a child under 6 that lives there or spends a significant time visiting. So like a grandparent could be a good candidate. Or if there's a pregnant woman who lives in the home, that also counts. Next. Okay, so what we've done so far, as you can see, we've made 124 homes lead safe since 2018. This is one of them here. We've been able to increase our production year after year, in part because of the contractor training program. We've been able to develop that workforce to increase our production and make these homes lead safe over time. Our goal for this current funding is to make another 125 homes lead safe by mid-2024. So that gives you an idea of scale. So that's all very great. I'm very proud of what we've done, but compared to those numbers of, 400,000 homes built before 1978 and 40,000 with young children in them, that's not going to get you there. So next slide. So another thing that people probably are curious about is the cost. So I kind of ran the numbers on what the jobs that we've completed thus far. As you can see, most of the homes that we've have in our program were built before 1940. We've like 100 of them before 1940 and the rest between 1940 and 1978. And there's a significant cost difference because there's a significant difference in the amount of lead paint present in those homes. So for the ones before 1940, you can see the average cost was about $12,000. And for the newer built homes, it was more about $3,000. So those are sort of a completely different scale in terms of what type of project. You can do the next slide. So another thing wanted to draw attention to is where these homes are located. There was a lot great in the presentation from the health department about where these older homes are, where the children are getting poisoned. And the city of Pittsburgh and the Mon Valley are kind of the place where this is concentrated. So this map is of all the homes that we've remediated over the years, but it's a little bit hard to tell where there's clusters and things like that because of the size of the pins. So this here is a list of the top 10 zip codes where we've done work. Most homes by zip code are in Mount Oliver and the southern neighborhoods of Pittsburgh, like basically it's 15210. So Allentown, Beltuver, Arlington, etc. And then next, Homestead, West Mifflin, a lot of homes over there in those legacy steel communities. The West End, Hill District, Homewood, Northside, and then East Pittsburgh, Turtle Creek, and then Carnegie snuck in there, and Duquesne as well in the Mon Valley. You can do it next slide. So then this is just another representation of where the homes are that we've served. So this largest slice of the pie is the greater Mon Valley, in which included Turtle Creek, and then the second, Pittsburgh East Central. So that includes Homewood, Hill District, Lawrenceville, and other areas in the city. Pittsburgh South is the next one, and then Allegheny County South. So that would be like Carnegie and anywhere south of that. I think we had one house in Crafton. And then Pittsburgh North Side, Pittsburgh West, and Allegheny County North, which is kind of a broad swath. It would include a couple places in Sharpsburg, and I think also one place in like Bellevue, Westview, or a couple in Bellevue, Westview, and then Allegheny County West, and that's basically McKees Rocks. Next slide. So yeah, another thing wanted to share with you is just kind of who we're serving through this program. One thing we looked at is owner-occupied versus rental, and it's definitely predominantly owner-occupied. I mean, I think the incentives are just extremely clear for homeowners to make their homes lead safe. It's also a way to, maybe get some upgrades in your home, new windows, new paint, things like that, you would be on the hook for yourself if you didn't have assistance from this program. But we also have like 30% rental, and about half of those are Section 8 housing choice voucher rental properties, often in a situation where a child has an elevated blood lead level, and they get referred by the health department, and enforcement kicked in by the health department. And then we had a couple vacant properties that we remediated, but that's pretty rare. In terms of income, so everyone has to be under 80% area median income, which is currently for a family of four, $67,000 a year. So it covers a decent chunk of our neighbors here, but the majority of enrollees in our program are also in the very low category, which is under 50% AMI. In terms of race, we served 41% Black or African American, 38% white, and the rest were smaller categories. I think this is like pretty self-explanatory and reflective of the fact that low-income housing and the elevated blood lead levels are, disproportionately seen in Black families in the county. We can go to the next slide. So one thing that we are going to announce right now is just that we are looking for community partners to help us with outreach and recruitment in this new grant that we have. We're looking for applicants, and we're looking for organizations with strong community ties to help us out with that. So the bid is listed on our website now, and if you have any questions, you can reach out to me directly. The applications are due at the end of the month, and we have a pre-bid meeting in a week and a half, November 8th. All right, that's all I have, but yeah, please feel free to reach out to me with any questions or if you're interested in this opportunity.
All right, thanks much, Jen, and I also wish to thank Luanne, Brian, and Dan. I'm going to bring forward Ashley Deemer, Deputy Director of the Penn Environment, to the stage for the next panel. Also, while we're doing that, I just want to congratulate Jen for the Allegheny led Safe Homes program and their recent award of making 125 homes lead safe.